I want to just briefly show you how I got here. And here's just an idea of a final product where we've got embrasures the way we want them. Everything looks good. The occlusal is not, I haven't carved any grooves in this, although it might look like I have at this point, but I haven't carved any grooves in this yet, and I'm going to show you how I got here, and to the point where, oh, that's a little better, to the point where it's very, very close to what we want for our final product, and I did it while I developed the rest of the anatomy on the tooth. So what I'm going to do is show you on another tooth, the maxillary premolar, how I got there. So what I've done is, the first thing that I always do is I go ahead and I just cover the preparation in wax. So I just get a layer of wax, and I make sure that the tooth is covered with the wax, and that when I do that, that the edges of the wax meet flush with the edges of the preparation. They're not hanging over the edge. And as I'm carving, I'll show you how I carve that back. But first of all, what I'm going to do now is, now that it's covered with wax, I'm going to put it back in the Typodont, and I'm going to start to put the cusps where I want them. So the first thing that I do is I develop the cusps. Let me just put this back together again for a second. Keeping Eric busy here. And I want to look and see, where do I want the cusps to land? So I articulate the upper and the lower part of the Typodont, and I look, and the cusps all line up in a row, and the length of the cusps are determined by the opposing occlusion, and they line up with the occlusion on the same arch, or the teeth on the same arch. So what I'm going to do now is I'm going to take and I'm going to put some wax just where I think the cusp should be. And I can look here and see, okay, the cusps are lined up in a row here and here, and I'm going to go ahead and just put a little, like a little drip of wax right over where I want my cusp tip to be. And I'm going to put it on the lingual as well. Just a little dribble of wax, okay? And it doesn't have to be perfect, it just has to be in the vicinity. Now, once it's cool and it's not shiny anymore, but it's still soft, I put the Typodont together and I see where I am at. Now I know I've got too much cusp length on this one. It's too long. I'm going to carve that back a little. And I can look at it from the inside and see where my lingual cusp is, and is it landing near where I want it to be. This is going to be hard to see, but I'm going to look in here. Oh, look at that. Wonderful. I'm going to look in here, and I'm going to want it to come into this marginal ridge right here, so it needs to come down and in a little bit. Okay, so we'll try that. So then I just kind of adjust as I'm going along. If I need to carve this down just a little, it's a little long. Carve down a little bit, and we add a little on the lingual. So as I'm working, what I'm doing is I'm looking, I'm making a judgment, and then I'm trying to remember what I have to do, and I go back and I do it, and then I check again. Wax is still a little soft. It's way too long, looks like, but at least now we're getting it right in the vicinity of where we need to be. Don't have anything else, so it's going to look kind of funny, but it's starting to come down into the marginal ridge of the first premolar, the distal marginal ridge, okay? So that's good, that's where we want it. And you do the same thing on a mandibular tooth. So we've got the cusps sort of where we want them. The next thing I do is I want to develop a facial contour. So now what I want to do is I'm just going to drip some wax just along the facial to get it in the neighborhood of where it should be. Just come one little line right down the facial surface of the tooth. And you can note how I'm moving the wax here. You guys want to just kind of, as you're watching me, you can even try and do some of this along with me. That's fine with me. And I'm going to look at it, and I'm going to look at it like this. And I want to see everything in a line, okay? So I want to see the contour of the canine. We're going to get this. contour of the canine, the contour of my waxing, and the contour of the premolar. And we're going to look and we're going to see, okay, now we know we've got a little too much wax right here. We'll carve it back just a tiny bit, okay? A little bit more. We are pretty close to the ballpark on the facial contour, just with one little line of wax. We need more wax down here. Can you see that? We'd have to pull the tooth out and just add a little bit more wax there. And we're ready to go on to the next thing now. Is this facial contour done? No, but we have a mark of where we want to end up. So we're in the ballpark. We have a frame of reference. And if you have a little frame of reference, then you can go on and you can fill in the blanks. I'll show you that in a sec. So now we've got a reasonable kind of an idea of where our facial contour is going to be. Not perfect yet, but it's close to where you need it to be. You can see that it's very close to parallel with the premolar and the canine. The cusp tip is close to where we need it to be. Now it's time for us to go ahead and let's do some proximal contacts and marginal ridges. And those, what I do is I just kind of, what you can do is you can kind of go, okay, my contact is going to be centered right about here. And out here, I can go like this, you can see the contact is pretty facial on the mesial. So what I do is just kind of put a little notch in the wax there where I know I need to add wax. And now I just drip a little wax on there and get a contact. Right about the area that I marked it. Doesn't have to be just right there, just kind of so I know where I'm at, okay? So we can come in and add after. And this one's more facial, so we're going to add it here. And the facial, half of the proximal surface. And then just kind of let it cool down until it's not shiny anymore. And you can stick it in there and it's still soft. And you can see, okay, now we've got an idea of where our proximal contacts need to be. And what I would do now is I'd start to develop a marginal ridge. Let's do it at the distal here. Just to kind of get an idea of what height we need to be at, remembering that the marginal ridges all line up. They're all the same height. And I'm going to do a cusp arm here. Distal facial, right from the cusp tip down to your marginal ridge. And you can do the same thing on the lingual. If your wax gets too cool, you just kind of heat up your instrument and melt it back a little. Now can you see it's starting to look more like a tooth, right? But I'll show you that it's not anywhere near done, but it's close. We've got a contact that's kind of got a little rub mark in there. You won't be able to see that maybe real well. But we need to fill in now all these contours down here. But look at this. We know that we've got to fill in enough wax to come to the edge of the tooth from your contact area. So we can just do that. And then all you have to do is fill in this area right here with wax. And then you come back and you do the same thing that I did at the distal toward the mesial. Get your mesial cusp arm developed. And then you just fill in these areas here and here with wax, and you develop your embrasures. You might have to carve it back a little bit, and you do the same thing on the lingual. I know it sounds, I go, well, you just do it, and you need to practice. But if you know to get yourself, first do your cusp tips, then do a facial contour, then do a proximal contact, cusp arms and marginal ridges, then you're pretty much there, and you just need to fill in the blanks, and you're going to have something that looks a lot like a tooth in a relatively short period of time. And if you do that and you develop your marginal ridges at the right height, what you end up with when you're all done doing that, and I've carved back a little and refined embrasures on this, you've got something that looks pretty close to what you want for your occlusal anatomy too. As you add your marginal ridges, make sure that you do close your typodont together. Bring your two pieces of your typodont together and make sure that you're not developing something that's too high. Okay? So now what I've done is I've looked at where my cusp tip was as I developed those embrasures and facial contours, and I made sure that it was pretty close to where I need it to be. And if you look, your cusp tips are all in a row, and they're all coming in and meeting the maxillary teeth pretty much at the same spot. And so that's where you want to aim your waxing. And you'll notice that not once have I looked at the contralateral tooth as a guide. I didn't need to, because I've got all these other teeth in here to tell me where I'm at. When I do my embrasures, I do look at the contralateral tooth, and I do look and see what does this embrasure look like, and am I matching that over here on this side for your facial embrasures and your lingual embrasures, okay? And then your gingival embrasures, I've checked that, and I made sure that I don't have too much wax at this embrasure area right here and here are right where they need to be. So now it looks a lot like a premolar, and we have to do the occlusal. That part's kind of the fun part, and what you need to do now is we know that we've got our cusps pretty much where we want them to be, so now is the time to go ahead and do some occlusal anatomy. And this is when I might look at the contralateral tooth, the tooth on the other side, and I'm going to look at things like, okay, this triangular ridge kind of comes down and it's more bulky toward the distal. I've got a central groove. I've got pretty prominent mesial and distal fossae. I've got a groove pattern that looks like this. And so I'm going to carve in a groove pattern that looks a lot like the one that's on this tooth here. So what I might need to do now is I look at it and see, do I need more triangular ridge? I might need a little bit more. I add a little bit more wax if I need it. At this point, you might want to switch to the dripper that's a little smaller, either this one, and if you really need to do some very fine anatomy, you can use this really small end of the dripper. And so I just need to add a little bit of a triangular ridge, so let's see what we can do there at the buccal. And I'm just going to lay it right on there. It's not hot enough, so we're going to heat it up a little. And just add that. Okay? I don't know if you can see it at all. Maybe if we put the light on, we might be able to see just a tiny bit better. There we go. So what I've done is, just by one little addition of wax, I've got something that looks a lot like a triangular ridge. And it's going to have to be carved back a little bit. But at this point, I just want to make sure I have enough wax on there so that as I go to carve back, I have something to carve back with. Now what I'd like to do is just double check and see where my occlusion's at, because I don't want to make this high. So let me just squeeze it together a little bit. That's what you would do. Just go ahead, squeeze it together. See if you get any little dents on the occlusal surface. If you do, then you've got a little too much wax. Help me out here, Dr. Abbott. Where do we want our contacts on this tooth? We can figure it out. We probably want one on the buccal cusp tip.
Mesial, on the
distal incline?
Buccal, yeah, distal incline of the buccal cusp against the distal fossa.
So we want one on the distal incline of the buccal cusp, and we probably want one on
distal fossa from the upper.
Distal fossa from the maxillary. Here we go. You can see I'm marking right here. I'm picking up wax from there, so now I know that I'm pretty close to where I need to be on my occlusion. At this point, the tooth is not screwed in, and this is just a word of caution to you. If you're going ahead and developing your final anatomy and your occlusion, what you need to do is you need to make sure that your tooth is screwed in, because as you screw it in, it lowers the tooth a little bit. Now, I don't know if this is going to show up, but I'm going to show you how I go ahead and I carve the groove pattern on this tooth, and how I check the marginal ridges and make sure they're where I want them to be. Basically, for the marginal ridges, if you have a lot of wax to remove, I just lay my instrument on the adjacent marginal ridge, and I start carving down till I'm down to the level of that marginal ridge. What I've got here is I'm pretty close to that. Then I want to develop an embrasure space in that marginal ridge. And so just give me a second, I'm going to try and screw this in here. Okay. I use the Hollenbeck carver or a Ward's carver to go ahead and do this, and just taking it sideways at the thinner part of the carver and just coming around, or taking the tooth out and rounding that out, will allow you to get a good marginal ridge. I want to just stop for a second and make sure. I'm thinking maybe I need a little bit more wax here. And we'll carve the grooves in. Again, whenever I add wax at this point, because I'm close, I go ahead and I recheck. I don't have a contact on my, here we go, here's something you can look at. I don't know if we can see it, but right here's a dent from where I put the occlusion together, and now we know we need it kind of on the marginal ridge, we need a contact. So what I'll do is leave this area and not carve back that part of the waxing, but up here where I was coming in and I'm still getting that dent, I'm going to move that cusp perhaps a little bit mesially, the cusp tip, so that I don't get occlusion right there, because I don't want it there. The other thing that I was just noticing is that the cusp tip is low on the buccal, and I'm not occluding where I want to on the maxillary, so at this point I'll add just a little bit there too. And I'm just going to go ahead and just add right just in one spot for now, and then pull it and close it together. I'm going to spend about 5 more minutes hopefully just showing you this, because I don't want to take a lot of your lab time from you. But if you want to, you're probably sitting there hopefully maybe waxing until you get to a point where I'm showing you something that's going to be helpful to you. So I'm just adding a little bit more here on the cusp tip. I'll have to carve it back a little bit, but we want to get some occlusion. So I'm going to close it together until I get that little dent on the occlusal surface that I want on the cusp tip, and it's right there. I might need to add now just to fill in so that when I carve back for my occlusal anatomy, I've got enough wax for what I want to do. So let's do that real quick. Let's see. Right there. Check my facial too, because I might need a little bit there just to make it look right. Whenever I add wax to something that's smooth already, like the facial surface of this tooth, I kind of feather it in with a warm dripper so that it doesn't have a line where I just added. So I don't know if you'll be able to see. I just kind of feather it in so that it's smooth, and then I can come back with my carver and just very gently, and this is kind of a rubbing kind of a motion here. Just rub it. Don't try to take away a lot at a time, and that gives me a nice smooth facial surface. Then anytime I have little extra bits of wax on there, I clean them away, and that's really important, and I'll show you why that's so important as we carve the occlusal anatomy on this tooth. Okay, I don't know how much of this you'll be able to see, but I'm going to go ahead, and what I do is I just kind of trace out where I want my groove pattern to be, and I'm looking at the contralateral tooth, and I'm just kind of doing a line so that I have kind of just like a guide of where I need to go for my groove pattern. So the Mesial Fossa is pretty prominent on this tooth. I'm going to go ahead and just kind of dig away a little of the wax there. I'm going to look at how this distal comes down. And then the central groove. Remember, this is a guide for you, As you're doing your central groove and you don't know how deeply to carve your central groove, they're all at about the same level. So I'm going to look at the tooth adjacent and I'm going to say, okay, my central groove's a lot higher up on the tooth. I'm going to carve it a little more deeply. I'm using just this instrument sideways, like this, so I get the central groove right to where I want it to be. And then I'll show you, once I get that, I'm going to get rid of this extra wax that I have here. And that's where the white end of your brush works really well. Just kind of brush it out of there. Now you can see I've got a little bit of a groove pattern there. And we're going to go ahead and we're going to refine that. And I'm not going to spend a lot of time, but as you do this, you'll get practice and you'll get better at it. But just take away the little bits of the wax and that'll give you a nice clean occlusal anatomy on this. And it'll give you a nice finish in your waxing. I come around on the triangular ridges and kind of round them out into the grooves. It's not quite right. You have to add. If you're doing it and you find out that it's not right, not the way you want it, and you need to add, just add a little at a time. So use that narrowest little dripper. And add where you need it. And sometimes you don't even need to carve it back because your addition is so convex because of the way the wax lays on the tooth. You've got a really nice looking marginal or a triangular ridge there all of a sudden. Okay, one more minute on this carving of this occlusal, and then what we're going to do is I'll show you how to check with the powder and see where we're at for contacts and how to get the contact exactly where you want it on the tooth. The groove pattern and your bench instructors can kind of help you with refining this, but you can get a really nice looking occlusal anatomy just by spending a few minutes keeping it clean, getting your grooves just right where you want them to be. And clean out the grooves a little as you go. I just like to use a Hollenbeck or the Ward's carver. I don't use a cleoid, but a lot of people like to use that, so it's whatever you're comfortable with. This is the point where it's kind of fun and I like to fiddle with it some more, but right now we're going to stop and we're going to check the occlusion and see. And I'd probably recommend that you do that before you spend too much time fiddling with your anatomy. So let's see what we've got here for occlusal contacts. Just put a little coating of the powdered sugar on. And you guys can't tap, so just kind of take your Type-It-On, put it together, give it a nice squeeze. Okay? See what you end up with. Now you're going to see, hopefully, I will show you too, because it's hard to see on the screen. I've got a heavy contact on the cusp tip. I've got a heavy contact on the triangular ridge right here. It's right there. I've also got a contact here and here. Now the one right here on the marginal ridge is perfect. I don't want to touch that. That's exactly what we want. Okay? But the one on the cusp tip is good, but it's heavy because I've dented. I don't know if you can see that. There's like a dent in the wax, so that means it's too heavy. You have to definitely get rid of this triangular ridge contact. I like to get rid of the lingual contact. So that's what you do. You just kind of carve those areas back. I'm going to bring the cusp tip down a little, round it just a little bit as I do it. And there's the base of the dent is probably going to remain. That's good because that's your contact. Okay? And then I'm going to take this triangular ridge, keeping away from the cusp tip, and I'm going to go ahead and reduce that a little bit and round it as I'm doing it. As you do it, you're kind of reshaping it back to the shape you want. And then my other contact was down here. I'm going to get that down too. Let's see if we're close. You don't need, maybe I'll put a little more powdered sugar on, but you don't need tons of powdered sugar to see this. If you put too much, it gets goopy and it starts to get sticky like a bad donut. So go ahead and squeeze it. Sometimes what happens when you do this is you see that you are really high. This is the case here. we're really high because we've got a contact here. Now we're picking up a contact here and here. So we're going to take this one back here because we don't want one here. And I'll probably take back the cusp tip contact just a tiny amount because I'm still denting into the wax. And then that triangular ridge was still a little high. The marginal ridge contact is still there and it looks good, so I'm going to leave that. And as I do this, I clean my instrument and then just take out any little excess bits of wax. Okay, we're just about there, guys. And squeeze again. We've got one other thing to check. Okay, we are right about where we need to be. You'll see if there's a contact here, it's heavy still, right here. There's a contact here, still one on the distal cusp arm. Let's just take this down one more time. I promise I'm going to be done in about 20 seconds. Take this one down. Recheck. Came down a little too far. This is, you guys have had this experience, I know. Came down a little too far on the cusp tip contact. We could add to that. We're very close to where we need to be. Now there's one other thing we need to check. And that's our lateral contacts. You want them to check that, don't you?
It's pretty crude with an articulator or type
I
it
know,
down.
it's going to be really hard. Let me just show you this. It's going to be hard for you to check this, but type it on if it's articulated like this with a joint or a hinge. What we can also do is check and see when the patient goes into lateral movements that we don't have a contact on our waxing. And this one does. I'll show you. Let me do this. Let me change the angle a little. There we go. You want canine guidance, right? There's your canine guidance. And we don't want to be touching. These other teeth are, they're pretty close, but they're just barely not touching. Let's try this angle again. Keep taking it out of focus. We're close on this one. And I'll show you right where it is. We're getting a mark right here. So we would take that down. So if you guys are able to check that, great. If you're not able to check that, you need to know that it exists, and you'll be checking it when you do your articulator exercise. So let me just show you the final product here, and then you'll be all set. And I can show you how to polish this up too once we're done. That just takes a second. Squeeze and check again. Here we go. We've got our contacts right where we want them to be. Got a distal marginal ridge contact. We've got a cusp ridge contact, cusp tip contact. Still getting a triangular ridge contact. We'll take that down. Now the next thing we do is we want to polish this. The best way to clean this occlusal surface is to have carved it cleanly, and then you don't have to do a lot of work with it. You can take your very clean carving instrument and just kind of go through the grooves and clean it. If you're really brave, you can take and go to the sink, and with this soft end, or either end of your brush, but usually the soft end works better, under cold water, you can go and just scrub right in there, and it gives us a really, really nice polish if you do that. However, the problem with doing that is the wax, as we know, changes a lot with temperature, and what the possibility is that in doing that, you're going to reduce the wax, you're going to shrink it, and your occlusal contacts may change. So you have to be pretty brave to do that. But to get the axial part of your waxing nice and shiny, we can go ahead and we can use a little nylon and smooth that. The main thing is, if you've done the job right, you don't have a lot of shining up to do to get the finish, because you did it, you kind of burnished it as you went along. And you got it just the way you want it. The other thing that you have to be careful is don't expect this to do wonders. This is just the final little bit of finishing. So if you do this and you work on it for a long time, you can change the facial contours of your waxing. So go ahead and just very lightly, watching your proximal contact areas, just very lightly, and you can see I'm not doing a lot here, and it's already very nice and shiny. You can even do a little bit at the occlusal part of your waxing. And now what we've got is a very nice waxing that's pretty smooth. The finish is good on it, and it has its proximal contacts. A word about proximal contacts. Once you get your axial contours on your waxing, hold this up to the light and look through it. And I can't do that and see it on the camera, but you look through it and make sure that you can't see through your proximal contacts. If you can see light through your contacts, you have an open contact, and right away that's the standard not met. I've seen a lot of them that have open contacts, and everything else about the waxing looks great, so just don't forget to check that. Are there any questions I can answer about doing the waxing and the final waxing and the occlusion? Thanks, guys. Yes, go ahead. Yes.
Taking off this way or this way, or the stroke that you take out?
What angle? The question is, how do you know what angle at which to kind of reduce the waxing as you're contouring? And it's whatever is convenient for you. If you're taking something off and kind of shaving it away, we learned in that Essentials course that if you're pulling toward yourself, it works better. You have more control of the instrument. So if you're going up and down or sideways or back and forth, it doesn't matter. It's just whatever's going to give you a smooth finish, and sometimes it just is driven by where you have to reduce.